Okay, guys, so this is what we're going to go over. We're going to go over the week 1 assignment, medical words. This has been a problem for everybody. I'm just going to put it on YouTube and go from there. I'll be looking down at it as we're working on it here. Looks like for some reason it's been locked. I'm going to move it up. And this is what we've got. So due Sunday night by 11:59 a.m. or p.m. So it's midnight, right, that night. But try to get it in earlier because sometimes those things goof this up. Select submit button, submit your assignment. So we have Mastering Healthcare Terminology is your book. So this is chapter 2 worksheet. And we're going to go, let's see. I'm going to look right down here and we're going to go to click worksheet. Right, there we go. And so we have this little worksheet pop up. Hopefully it'll pop up for us. There we go. And so we're going to work on some of this. How can I do this and make it big? Here we go. So we're just going to make it big and we're going to go from here and work and look at this. This is how to do this assignment, okay? So as I'm looking at it over here, we have, I'm going to shrink myself down here and put myself right over there. That way I can see what's going on. See, I can see you and I can see the page, and I can point to different stuff like up and down. Okay, so prefixes on here. This is the first part of the word, and so you have like afferent or bilateral or contralateral or efferent or endoscopy, which is looking in, episiotomy, which some of you may have even had, and ipsilateral, metaphysis or metabolic. Okay, uni means one actually. Okay, bi means two. Okay, so what you do is you would fill in this section here. You can either do it on your computer or you can do it on a piece of paper and you can take a picture of it and send it to me. Not a big deal. So this is like here. Let's go down here. 1, number 3. Okay, 1 of these prefixes means one. Which one? So we know it's uni. So we're going to write here, put in there uni. Okay, that's what it's going to be. Okay, that's how we're going to do that. Down here, the combining form 2 is the next section. So we have a prefix is the first part of a word. The combining form. So let's look at these here. So you could have like, let's take axillo. Axillo, which means armpit. Okay, so you could have bi, which means 2, or contra-axillary, the opposite armpit is what that would mean. Or let's say like epi-axillary is on top of the armpit. Okay, axillary, think of axe. Remember that stuff that everybody was using for a while there. So combining form, and then you have another definition of these too. Here we go through here. Can we get down to the next page? Yes. So we go through here and we're looking at the combining form, which is the center part of the word. So each one of these. So there we explain that one, right? You hopefully we're good at that. Now here, a whole bunch of those combining forms. So let's look at these here. Antero is more the front, is anterior. Okay, axillo, armpit, brachio, arm, caudal. So caudal versus rostral. Caudal on the front, rostral on the front. Like his rooster's thing right on there. That might be in here somewhere actually. And we don't have rostral on this one. Okay, so cephalopod. Cephalopod means octopus, so it's like a pod means foot, and then head, so it's like a foot head is what an octopus really is. Cervico has to do with the neck. Corporal, so when you talk about corporal, you think of corpse. Okay, it has to do with body. Cranial. Yeah, this is this stuff. Okay, cyto always means cell. Okay. Dextro and levulo. So you have dextro as the right side and levulo is the left side. We use those mostly in chemistry. So you have a chemical that is the dextro turn to the right, or levulo is turned to the left. So L-lysine is turned to the left, the chemical, the way it's built. Histo is like histology is the study of cells, the study of small things, right? And cells and tissues, actually. Inguino, that has to do with the groin. Laparoscopy, right? Inguinal hernia. Those are the things you heard. Lateral epicondylitis. That's this side here. Lateral on the outside. Epicondyle. Epi on top of the condyle, a little part of the joint in here. That's epicondylitis. Medio, posterior, proximo. Proximal is proximal, right? Towards your center, and distal further from your center. Sinistro. Sinistro is another word for levulo. Okay, so sinister is left side. You used to say that's the bad side, but it's not. There's people that are left-handed. Just three wrongs don't make a right, but three lefts do. What, two wrongs don't make a right? Well, something like that. Whatever, you know what I mean. Visceral has to do with the guts and stuff. Okay, so now here, this is the one that caused the most problem. What the hell's a word shop? This is a word bank. Okay, it's not even a word bank, it's a word shop, because they're saying like you build words with this. So let's look at bi. There's bi right there. That's two, right? Two cranial, two head, two. Let's do bi. What's a good one we can do? Well, let's do cranial. So bi cranial. Oops, cranial means head, right? Cranial, skull. So bicranial. There you go. That would be a word. Contra. Sight against. Contra means against. So you have to know what each one of these means. So bi means two. Contra means opposite. Hyper, more than. Hypo, less than, or low, right? High and low. Hypertrophy is increased growth. Hypotrophy is decreased growth, but you don't use it that much. So you say like hypotonic or hypertonic. You could use those for the amount of movement of water and things like that. That's back in osmosis land, right? Those kind of things. Inter, inside, intra, across, ipsi, same, mid, in the middle, and supra, above. So you can use all of these words here to make other words. These word parts, prefixes in the first, pre, and then suffixes on the end, and then combining forms in the middle. So you can make different words that way. It's just like a little a way to use to make words. Okay, so now that's just our list. Now this one here, instructions. Build the following terms by combining the preceding word parts. So you take a prefix and a combining form and a suffix, right? Some word parts may be used more than once. That's right. Where are we at? That's right up in here. Okay, some may not be used at all. The number in parentheses is the number of word parts needed. So this is good to know. So pertaining to the middle of the sagittal plane. The middle of the sagittal plane. So what's the sagittal plane? Sagittal plane cuts this way. So if I cut my ear off, that's a sagittal cut. Okay, so a sagittal cut here cuts this way, or this way, or this way, or this way, or this way. Remember transverse, this way, this way, this way, this way. Or frontal is, or coronal is this way. This is the frontal or coronal suture right through here. So it cuts there we go, like cuts like this. That's a frontal cut. Shows the front. Okay, cut my nose off this way. That's a frontal or coronal cut. So here, pertaining to the middle of the sagittal plane. If we go back up, look here. Go back up. Okay, so middle. We're going to find here. Oh, there's mid right there, and we know that sagittal. Okay, so there's sagittal, mid sagittal, mid sagittal. There we go. So we'd write mid sagittal right there. Okay, that's what we would write in there. Let's do another one here. Study of tissue. It's two parts. So study of, we come up here. So histo. Remember that we talked about that? Where's histo? We don't have histo. Histo. Okay, so you might not have to have the first part. We don't need the first part. We don't need anything. So we have found histo. There's histo. And then histology. Histology. Histology is the study of tissues. Do you see how that works? So sometimes you're going to need only a prefix, and a combining form, or sometimes you need a combining form and a suffix. Got it? Rarely are you going to use prefixes and suffixes by themselves. So you're intrology, not really. Ipsiology, no. Midplasm, no. You can make up words, but those don't make any sense. Okay, so you're going to use either a prefix here, and a combining form, or a combining form and a suffix. Okay, if it's two, so just keep that in mind. If it's three, you're going to have all three. Okay, let's see. Study of tissue. Let's see another one. Formation of cells. Ooh. So we're going to look for cyto, purse, right? So we know that's cyto. Okay, so formation of cells. Cytology? No. Cytoplasm? No. Formation, it might be cytoplasm. Hypercyto? No. Incyto, intercyto? No. Ipsicyto? No. Midcyto, supracyto? No, none of those. So it's cyto, Cytal, okay, that's possible. Cytart, no. Cytotic, no. Cytoia, cytior, cytology, that's a study of. Okay, cytoid, possible. Cytoplasm. Cytoplasm is probably the best one. You can look it up. Okay, next part here, translations. You have to translate the words. This is most of this stuff. Sorry about you guys who had problems with this. I mean, it is really unclear, and it did take me a while to figure out what the hell was going on. It's very confusing, and it's not you, okay? So here we go, trying to get this done. Okay, instructions: replace the yellow highlighted words with the correct terms. Okay, let's go down and let's do number, like, here we go, in between the lungs. A tumor growing in the, number 9. A tumor growing in the space between the lungs, pressed on his esophagus. Space between the lungs, in the patient's space between the lungs, that would be like the mediastinum or mediastinum, okay? That's my first guess, but let's see. The patient was in a lying on one's back position. Where do you find the... Okay, so you just got to know the term. So lying on one's back. Lying on one's back is supine position, so that the physician could examine her abdomen. Supine and prone. Supine is face up, prone is face down. If you're looking at it this way, hold a bowl of soup, you hold a bowl of soup on your belly if you're laying on your back, and prone is like a pro basketball player. Okay? Epi, right here, pertaining to above the stomach. Mr. Jones had epigastric pain, for example. Okay, so that's all I wanted to do with this one. That was a good, 12 minutes, something like that. I'm going to try to look at my computer. I just want to get this off to you guys today. You guys are doing midterms this week. Keep it up. Go crazy. Do your thing. Do your best. I know you can do this. You guys are killing it. You're doing really well. Most of you are doing spectacular. A couple of you are on the struggle bus, but I think those are technical problems. It's not because you don't understand it, because I see there are stuff that you guys are doing. So you're doing really well. Keep going, okay? We'll get this going today. I'll get this on the line. Bye.